Welcome to part 2 of my series of courses on heart health. In this one, I'm going to talk about nutrition for managing high blood pressure. If you missed out part 1 of my series of courses on blood pressure, I would highly recommend that you check out that one as well. It was all about facts that you really need to know about blood pressure. In that one, I discussed blood pressure, heart rate and pulse in detail, underlying causes, risk factors and symptoms of high and low blood pressure, health risks of uncontrolled hypertension. We also talked about clear signs of a heart attack and stroke. And finally, I talked about metabolic syndrome and how is it linked to heart health, especially blood pressure. Most of the time, high blood pressure has no obvious symptoms. Many people with high blood pressure don't even know they have it. The best way to protect yourself is being aware of your risks and making changes that matter. High blood pressure develops slowly over time and can be related to many dietary and lifestyle mistakes people are making, unknowingly or maybe knowingly. You see, there is not much that can be done about your genetics, but you can certainly take your health in your own hands by controlling your environment. That is your diet and your lifestyle. High blood pressure can be managed effectively through lifestyle changes in conjunction with medical intervention. We need an integrative approach. I would urge all of you to do all you can to avoid this serious health condition that can be playing the role of a silent killer in your life. I would like to share my personal story with you all, and it's my mission now to educate people on the preventative aspect of heart health. We as a family got a wake-up call when my mother-in-law suddenly passed away a few years ago at the age of 76. You see, we had been ignoring the fact for so long that heart disease runs in my husband's family. Now, when I say heart disease runs in the family, it's not all about genetics. It's the dietary and lifestyle habits also that run in families. Even my father-in-law had his first heart attack at the age of 52, when he had to undergo an emergency angioplasty while he was on vacation. After 5 years, when he went for another angiogram, his arteries showed 80% blockage again, and he had to go through another angioplasty procedure when stents were put in his coronary arteries. It was after that second procedure he decided to take his health in his own hands and completely revamped his diet and lifestyle. He now lives a healthy life at the age of 85, and recently doctors advised him to stop using blood pressure medications as his heart seems to be in good shape. We got another wake-up call when my dad at the age of 74 one fine morning woke up with 2 out of the 4 classic signs of stroke. All of us were shocked. How could this happen to him? He never had any signs of heart disease, and no one in our family had high blood pressure or high cholesterol. Fortunately, he was rushed to the ER and was attended immediately, and by the grace of God, he has recovered well and has started following a heart-healthy diet and lifestyle. I have made it my mission now to spread more awareness among my family members and friends on how to stay healthy and fit for as long as you live on this planet and how to age gracefully. After all, it's a blessing to be born on this planet. The purpose is to experience happiness in the real sense. And you can't be happy if you're not healthy. So in this course, which is part 2 of my series of courses on blood pressure, I will mainly talk about nutrition for managing blood pressure. We will begin by talking about the dietary guidelines for managing blood pressure, and I will basically talk about the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. This is a heart-healthy eating plan designed to help manage high blood pressure and is also endorsed by the American Heart Association. Now, based on my own extensive reading on heart health, I am personally more inclined towards a whole foods plant-based diet. So along with giving you details of a DASH diet, I will also share my own thoughts on what has worked for my clients over the past 2 decades of my holistic nutrition practice. After learning about the DASH diet, I will move on to giving you some facts about sodium and potassium. Now, we keep talking about ways to cut back sodium in order to reduce our blood pressure, and we think that skipping table salt is the best option. However, most of the sodium in our diets come from packaged and processed foods. So, skipping pre-packaged, processed, ready-to-eat, microwavable or canned foods can help reduce your sodium intake drastically and can lower your blood pressure as well, or even prevent high blood pressure from developing in the first place. But if for any reason you have to rely on prepackaged foods, then keeping a track of sodium can really be tricky. So taking control of your sodium means checking food labels. Therefore, in this course, I will also talk about learning to read the food labels. Moving further, we will discuss specific nutrients really beneficial for lowering blood pressure. This will translate into specific foods for lowering blood pressure, as well as specific herbs and spices for keeping your blood pressure in check. I will also share with you my favorite blood pressure friendly drinks. And finally, we will talk about the benefits of intermittent fasting. Now, for ages, people have been fasting for religious purpose, but research now shows that intermittent fasting may improve your overall health in many ways. The benefits seem to go beyond weight loss. More and more research shows that it also improves our heart health by lowering blood pressure, lowering LDL cholesterol, improving our insulin sensitivity, and give us better blood sugar control as well. If you are new to Ayurveda or holistic nutrition, I would highly recommend that you check out our other self-paced online courses on our website myholistickitchen.com. These courses have the potential of taking you on a healing journey, of restoring your overall health and renewing your vitality and outlook on life by educating and empowering you to take charge of your health and well-being. Looking forward to connecting with you all. Namaste.